All right. Good afternoon, everyone. Good afternoon. I've got a very special guest today. I'm excited. Met Renata, I don't know, about a month ago, I think, or a little over a month ago,
Mhm.
and she specializes in Medicare. And I wanted to talk to her because now it's the open enrollment period, and she might correct me. It might be the annual enrollment period, but we'll go over that. And so I know that Medicare is very it's important in our community to get all the help that one deserves, and it's out that's out here. And in many cases, we just don't know. We don't talk enough about things like Medicare and other things in our community. So I asked Renata to come on and just kind of talk to us about what this annual enrollment period is all about, this annual enrollment period, and just kind of tell us a little bit about herself and how she got into financial services. And so, Renata, just welcome. Thank you for doing this with me, and introduce yourself.
Okay, well, thank you for having me. And again, I'm Renate Brevard, and I'm a realtor in Maryland and Washington, D.C. And I'm also a licensed sales agent for United Healthcare Medicare Advantage plans.
And let's just go back. How long have you been in real estate, and how did you get into real estate?
I've been in real estate actually since 2004, and I got in real estate because a broker who sold me two of my homes. She had small children at the time, and she told me if I got my real estate license, I could help her out by going out and show houses on it because she couldn't work on the weekends, and the weekends are big time for showing homes. So that's how I got my real estate license. And I just continued to go from there. I put it on inactive when I got injured years ago. And I put it back on, I put it on inactive and I put it back on active. And I was doing it part time. So I just pretty much started really diving all in full time the past few years.
And tell, what do you like about the real estate industry?
It's always changing. Every situation is different. um, it can be challenging at times, but I just love going out, showing the homes, and um, uh, um, what am I trying to developing relationships with my clients when I'm out there. A lot of them have ended up becoming friends of mine because we've been out there looking at homes. I've been selling their homes. I just really enjoy it.
Good. And then at some point, you decided to get your life and health insurance licenses. Tell us about that.
It kept, well, actually, what happened is when I mentioned just now about being injured, I was actually at home for 13 weeks with a bad ankle break. And I kept researching just a lot of different things, and the life and health insurance, the financial services piece kept coming up. So I decided to get my license, and because I thought it was a good fit. It can be the same clients that you use for real estate can be the same clients you use in financial services and vice versa. So it's just another stream of income, and it just really worked. And I had originally had a strong health insurance background. So that's how I gravitated, I think, more to the health insurance side.
Okay, but you have your life and health, you
Life.
have and your real estate license. I asked you this before, so this is going to be a tough question for you. Which do you like the most?
I know, and I can't seem to come up with an answer for that. But now that I'm thinking about it, it's probably whichever one is generating me the most income at the time because they both fit. When I have a slow season for real estate, I'm still generating income on the financial services side. So they really do both fit well together.
And it also seems like when it's the slow season for real estate, like we're on the real estate side, we're starting to slow down now a little bit.
Correct.
Since we're in the annual enrollment period for Medicare, things are really picking up. So now is when between now and is it December 7th,
Correct.
you're really starting to work a lot on the healthcare side, and then you get paid out in January when it's the slowest on the real estate side.
That's correct. That's correct. And when the pandemic started, March 2020, I'm grateful that I had been out promoting the Medicare Advantage plans, and I did get a huge payout, and that's what kind of carried me through when those months we were shut down.
Good. And so they both work hand in hand, and for that reason is why I decided. I actually decided many years ago, but just took a leap of faith a few months ago to really get started in the financial services side, just to give my real estate agents, another stream of income, like you discovered many years ago. To my surprise, a lot of my real estate agents already had life and health insurance licenses.
Mm-hmm.
And so they're using their current clientele on the real estate side to sell, policies.
Right. That's right.
Mortgage protection, final expense, retirement policies, things like that. So it really does, as I can see it, it really does work hand in hand.
Yes, it does.
And so of all the different types of insurance that you could sell on the life side, and I just mentioned some of those on the health side, you kind of gravitated towards a specialty in Medicare. And so why? Why did you decide that was going to be kind of your niche, Medicare?
It was actually the connection that I made. Actually, I actually met Bill Reed, and he was telling me about the United Healthcare product. And United Healthcare, they provide you with everything. They provided you, with free business cards, all your free marketing material, and they have a really great support team. Even when we're going out and I'm doing a presentation, they'll provide whatever you need. It could be ice cream if you have an ice cream social. It can be bingo. They have all types of activities. So that's how I gravitated towards United Healthcare. And in addition to that, a lot of the seniors really are confused this time of year and during the year because they are getting inundated with all types of phone calls, all types of scams, and they're really confused about Medicare and what they should do and whatever and what benefits are available to them. So I feel good about being able to really help them because they need it. Some of them don't have children to help them and they're alone. So they need somebody they can trust also.
And so, as we mentioned, now, I think it was starting October the 15th through December the 7th, is what's called the annual enrollment period.
Correct.
And so what does that mean? What's the annual enrollment period?
The annual enrollment period is the time when a Medicare beneficiary can add on a Medicare Advantage plan, or they can drop a Medicare Advantage plan. And then actually, it's so ironic. So from October the 15th through December the 7th, they can add on these plans. So this is why every channel you turn on the TV, you see Kaiser, you see United Healthcare, Humana, because they're trying to, get the people to, enroll in their plans. And so then when January the 1st rolls around, it's the open enrollment period, meaning they can still, anything that they add now, they can still drop it and add it in from January through March 31st. But the difference is the Medicare beneficiaries, if they did not enroll in Medicare Part A or Part B when they were entitled to it, they can also still enroll in their Medicare plan. Some people don't enroll, and that gives them another chance to enroll from January to March 31st, because if they don't do it by then, and they need Part B, they're going to be penalized after that. And the penalty never goes away. So they're going to pay a higher rate.
And so there may be people listening now or later that are aspiring to get their life and health license, or may already have it. In terms of the payout and the renewals, let's just keep it with the state of Maryland. What does the payouts look like for a new enrollee that you're selling a new policy to? And then also, what are the renewals? How much you get paid for all the renewals for many, many years?
Okay, I'm going to use an example because they change it year to year. It changes, and I think it's I think the $575 is really for Washington D.C., but it's it might be $550 for Maryland. So when you write a policy, you get $500. Like I said, don't quote me on that exact amount, but it's $5 something. So
I think it's a little higher than $5. I think it's like something like $587, something like that.
Right. I don't recall what the new rates are, but you get that per person. January. So anything that I'm doing right now will pay out the first week in January. You'll get half of it then, and then 2 to 3 weeks later, you get the other half, but you get $587 per person. And then the renewals start the following year. So you get, I think it's $26.50 per person for renewals, but it really adds up. So if you're doing 100 people, then you're going to get $2,600 a month.
You said 2,600, not 2,600 for the renewal.
20. No, right. It would be 20. No, if you do 100 people.
Oh, if you do 100, but let's say for that one person that you sold the policy to, what do you get for that person next year?
You get $26 per person. You see what I'm saying? It's every month though.
Right.
You get a check every month. Right. So the goal is to enroll as many people as possible, because you're going to multiply that by 26.
Right.
So that's why I used 100, because it was just easy math, and it's durable to write 100 people. So if you did 100 people and it's 587, and you do the math on that in January, that's what you'll get paid. And then the following year is when you'll take that same 100 people and multiply that by $26.50, and that's a residual check you get every month. But in addition to that, you're still able to write during the year. You see what I mean? So even if you don't, okay, so when December the 7th cuts off and January rolls around, you're still able to enroll people. So you're still adding on to your book of business.
Absolutely. So you just keep adding on every year.
You keep adding on, right?
And so you could get up to 1,000 people over a certain period of time.
Oh, most definitely.
On the renewals now. So you have the annual enrollment starting in January. It starts the open enrollment. What's the criteria for people? Let's say after January 1st. What's the criteria in terms of age, health conditions, that after January 1st you can enroll?
The health condition doesn't matter. So it's not underwritten. So as long as they have Medicare, well, some of the plans are just Medicare. Then some are Medicare and Medicaid plans. So the age, though, they have to be 65 or older, or they're under 65 with a disability. It could be end-stage renal disease. It's another, I forgot what the other disease is that is called, but they could have another disability because there are a lot of people that are not 65 that have Medicare Part A and Part B. So as long as they have, and that's the red, white, and blue card. And anybody can, they can enroll if they have not, if they were entitled, say they were entitled to Part A, they had turned 65 in August or something, and they didn't enroll in their Medicare, they can enroll in it in January. They can sign up in January and not be penalized.
Okay. And talk to us about, I see the term Medicare Advantage.
Right.
Explain that to us.
Okay, Medicare Advantage is a health insurance plan like United Healthcare, Humana, Kaiser, Cigna, who offer, if you have Medicare Part A and Part B, it doesn't cover all the things that someone may need, like dental or vision or hearing. So they will take a Medicare Advantage plan from an insurance company, and they will go, in United Healthcare's case, you have to go to see a doctor in the network in Maryland. Okay. And in Washington, D.C., it's a PPO, so they can go anywhere. But they'll use that card instead of using their Medicare card. They still have Medicare, but they're going through an insurance carrier to get their prescription drugs. Because a lot of them, if they just have a straight Medicare card, they still need a prescription drug plan. And so then they'll have to pay extra for the prescription drugs. So in essence, the Medicare Advantage gives you all of that under one. You don't have to go have separate, Medicare card, a Medicare, prescription drug plan. You'll have everything in one.
Okay.
Did I describe it?
Yeah, absolutely. So that's Medicare Advantage.
Correct.
What are the quick differences between like Medicare Part A, Part B, C, and D?
Okay, Part A is hospital only. So the Part A applies to any inpatient hospitalization costs they have. Then you have Part B is physician costs, which is the doctor's offices, doctor's visits, labs, x-rays. That's what Part B covers. Part C is the Medicare Advantage. If in some of the brochures, you'll see A plus B equals C. So C will give them all of that. D is prescription drug plan. They do have standalone prescription drug plans that people pay for. So that's what I was saying earlier, is that if they had Medicare Advantage, they could have everything under one umbrella instead of having everything separate. And there are some people that have Medicare Part A that don't have Part B because you have to pay for Part B.
What are the differences between Medicaid and Medicare? And second part to that is, can you use both together?
Okay. Medicaid is income driven. So Medicaid will allow a Medicare beneficiary to get extra benefits, or meaning the Medicaid will help them pay for their Part B premium. It'll help them pay for their co-pays, because if you have Medicare you go to the doctors, you still have co-pays. So if you qualify for Medicaid, Medicaid will come in and pick up those balances, but it's based on your income. Everybody doesn't qualify for Medicaid.
And who administers Medicaid?
Medicaid is administered by the state of Maryland.
Mm-hmm.
Or whatever state you're in.
Right. And so Medicaid is administered by the state. Medicare is a federal program.
Correct. And even some people, if they don't, which they don't know that, if they don't qualify for full Medicaid, they can still qualify for, it's called extra help or qualified Medicare beneficiary. So they may not qualify for full Medicaid, but they could qualify for a program that will help them pay for their prescription drugs. It might help them pay for part of their co-pays. They just won't have the full privilege of Medicaid because each one has a different income level.
Okay. And so what are some of the extra benefits of being on Medicare?
I've been on Medicare?
Yeah, like the transportation, dental, vision, things like that.
Okay, now that would be under the Medicare Advantage plan. So that's one of the benefits of the Medicare Advantage plan, like United Healthcare, because if you have, so Medicare, if you have Medicare only or Medicare and Medicaid, they do not cover dental. So a lot of seniors, they need dental, they need dentures, they need root canals, extractions. They will be able to get that under the Medicare Advantage plan. Like for United Healthcare, if you have Medicare only, you get up to $1,000 a year. If you have Medicare and Medicaid, you get up to $1,500 a year for dental. Medicare does not cover hearing aids. So that hearing aids is something that's covered, which a lot of seniors need. And they offer transportation. You can get free transportation back and forth to, it has to be medically, for medical purposes, though, to the doctor, to the pharmacy to pick up your prescriptions. That's free. And then the big one that's just coming out for 2022 is the over-the-counter and the grocery debit card. So a Medicare beneficiary that has Medicare and full Medicaid, they're able to get a debit card where they can go to Walgreens, Walmart, CVS, Giant, Safeway, and they're able to use that for groceries every month. But they can also use it for over-the-counter items, Band-Aids, toothpaste, alcohol, lotion, Tylenol. They use it for whatever is approved on the list. And then for the groceries, they just have to make sure they're buying healthy food. No, you can't buy cupcakes, you can't buy cookies, but you can buy healthy food, meat, poultry, juice, milk, all of that is covered on that debit card.
Okay. And so tell us, this is your busy season. What's kind of a day in the life of Renate during the annual enrollment period?
Well, as soon as I get off of this podcast, then I'm going to shoot out the door. I make a lot of contacts. I try to set up as many, we don't have as many events as we had before because of the pandemic. So I, find an event that I can go to. I go to different places where there may be seniors in need of some of the benefits that I just mentioned. So I try to make sure I get in front of as many seniors as I can between now and December the 7th. And I'm making sure that I'm educating them because this is really big. A lot of them just do not know. They're confused with all the television commercials that come on. And so I just try to make sure that I'm in a lot like churches and a lot of different places where they just may have questions. And a lot of times I'm helping them, and it may not even, they may not even sign up for Medicare Advantage plan, but they need some sort of help, with their medical bills. And I'm just out there trying to be there for them.
What are the restrictions for you and everybody else selling Medicare as it relates to kind of marketing to seniors?
You cannot go up and approach anybody. They have to come to you. So that's why it's important to me to, be places where then I'm set up and they see who I am. And they'll walk over because I'm in the kiosk. They have a retail kiosk in some of the Giants and some of the Walgreens. And they'll walk over and say, well, what is this about? And then I'll tell them what it's about. And I mean, they may sit there, well, the doctor's sending me a bill every month. I'm going to the doctor and he's sending me a bill every month and I can't afford it. But you cannot go out. If you just see somebody, you can't just start passing out information. That's a no-no.
Also, other than the health insurance license, what other either license or certificate do you need to sell Medicare or education?
You have to do a certification under the carrier. So even with United Healthcare, we have to recertify every year. And it's really not difficult. You go through, a few modules and you just answer a few. They give you a test at the end. And I can't even remember how many questions it was, but they give you a test at the end. And as long as you pass the test, then you're fine. But you do have to recertify with the carrier. And that's every carrier. Every year you have to recertify.
Yeah, you're with United Healthcare. When you're out and about, like you'll leave this podcast and you'll go out, you don't see a lot of competition, do you?
I have not. I think I ran into a little yesterday because we were making some phone calls, but no, I have not, especially not in Prince George's, Charles County, some of the surrounding counties. Washington, D.C., yes. But they've put a pause on any, you can't write any Medicare. Well, if they have Medicare and Medicaid, you can't write in Washington, D.C. right now until after the first of the year.
And so in places like Prince George's County, Charles County, is the reason that you don't see a lot of competition, is it because of the lack of health insurance agencies or agents? Is that part of the reason why?
I think so. Well, when you get to the southern part, I think it also has to do with there were not a lot of plans available to them. So in Prince George's County, United Healthcare is new coming to Prince George's County. Right. So I anticipate probably maybe not this year and maybe not next year, but I anticipate probably more people once they see what's going on, then it'll be more agents out there. But right now, I haven't run into that issue at all.
I guess for you, that would be a good thing. You can turn your goal of 100 people in this annual enrollment to 1,000 people. If you get enough people under you.
That would be lovely. I'm trying. I'm definitely trying. It's not, such a small window. After December the 7th, you're not allowed to write anything else until January. But I mean, it's okay because when January comes, you can pick up where you left off.
Yeah. And that's one thing that I've seen in the financial services space that, there's a lack of financial services people. Only 4% overall are people of color. And I think for that reason, we're not getting the word out into our communities other than, what they see on TV. And like you said, those things can be confusing. So we need more financial services people, life insurance, health insurance, agents out here selling these products, but more importantly, getting the word out to our community so we can take advantage of all that the federal government is giving, the local government, state is giving out. And without people like you and a few of your other colleagues getting the word out, we miss out. We miss out because of really lack of education.
That's true.
And so that's part of the reason why, we started Big Life Financial Services is to, get more agents to get out like you in the community to, give that good information, but then also people like you to really become entrepreneurs, and that closes, the wealth gap.
Mm-hmm. That's true.
And so what would you say to someone who's interested in getting their life and health? What would you say to them? More importantly, what would you say to them if they want to get into selling Medicare?
Well, they have to be, you should be diligent about what you're doing. It's not an overnight success type thing. And you have to, you just can't scatter yourself all over the place, because people feel more comfortable when they see you around consistently. So that's something else that I do. The first time, they'll look at you, and then when they see you coming back and they see that you're helping them, the business will come. The business definitely will come. So I think they just need to be diligent about what they're doing and not scatter yourself, and pick, a few good places or whatever that niche is going to be, and just stick with it. And it will come.
And so, Renata, last question: where do you see yourself? What are your future plans? Where do you see yourself? Let's say 3 years from now.
Well, 3 years from now, I see myself. What is it, with the real estate and the financial services?
Well, we know you're going to be with Bennett Realty Solutions within the next 3 years.
Right. Right.
And investing in real estate.
Exactly. I definitely want to do that.
And so where do you see yourself just kind of overall?
I see myself building a outside of the real estate investor, having a team to go out there and just train. And I've been told that I'm pretty good about going out, finding all of these different places we can hang out and generate business, but it's only one of me. And so just trying to build a team of people that I'm willing to share the business with, so everybody can be successful. My mind is turning all the time.
Absolutely. And that's really how you make your money, is through building a team and getting overrides. Mm-hmm. And so you get the overrides, you get the renewals, the bonuses, things like that. And in the financial services space, that's really how you make your money, and what gets me excited. And then if you build a big enough book of business, there's a lot of people just waiting to buy your book of business. And again, that's another reason why I just kind of love the industry. And mm-hmm. you're a shining example of what can be in this industry, but then also a good example for my real estate agents that want to do both, because as you said earlier, you're selling, in some cases, financial products to your real estate agents, and then vice versa. So you're using your book of business, your database, both for the financial services side and for real estate. Correct. And then the ultimate model that I've seen is, now you take your money from both sides and then invest it in real estate. And so that's a model that I've kind of seen across the country with a lot of financial services people do, because you're learned on the life side, a lot of the annuity products, IULs, index universal life policies, mm-hmm. things like that, to protect your income, but then to also grow it. I've seen a lot of financial services people take their money and invest in real estate.
Right.
So those are a lot of the things that we'll be teaching.
Right.
All right. Any last advice for people looking before we let you get out and start making some money?
No, just consider, consider that it is like I said, it's a good stream of income. It's not you're not getting, when you're selling houses, you're getting a big chunk of income. So, you're doing one by one with the policies, but it really adds up. And like I said, having a monthly residual check-in is not bad. It's like getting a paycheck that you already worked for last year. So it's not bad. So, they should consider doing it. And before, years ago, I wasn't even thinking about Medicare Advantage. So it's definitely worth looking into. And like I said, it really feels good, though, when you are helping the seniors, because they need a lot of help. They have a lot of people that prey on them. So my heart is really in that. So I really do try to help them. I'm not just automatically pounding on them for some type of sale, because these are benefits that they really need and that they can really use.
And for you and other entrepreneurs, one good thing about Medicare is once they purchase the policy and you make, whatever you make, $587, there's a high percentage of them that renew and keep it for the rest of their lives.
Mm-hmm.
And so you don't have a lot of what's called chargebacks at all.
No, not at all.
They could get it and keep it. It behooves them to keep it forever, keep it for 10, 20 years. And you're getting paid every year on that one policy. Like you said, the $26 a month. I mean, that can add up. Depending on, and that's just renewals, depending on, how many policies you sell within the next, say, 10 years. So the longer you do it, the more money you're going to make and the more the residuals are going to start adding up every month for you. And like you said, it equates to a big paycheck. While for you, you're also selling more policies and you're selling real estate.
Right. You can be out selling real estate and your check is still going to be in the bank next, every month while you selling real estate.
Nothing wrong with that.
No, not at all.
We like that. All right, Renate, I'm not going to keep you any longer. I really appreciate you coming out. We actually have our investor monthly meeting this Saturday at Martin's Crosswinds at 9:00. And so Renate, she will actually be there. If you guys want to come and meet with her, it's at 9:00 in Greenbelt, Maryland, at Martin's Crosswinds. She'll come in and she'll say a couple words. But if you want more information on the Medicare program, if you're a senior, or if you're interested in selling Medicare, come speak to her Saturday morning. She'd love to meet with you, love to talk to you, and give you as much information as she can.
Most definitely. I would be more than happy to do that.
Okay, Renate.
Okay.
Thanks a lot. I really appreciate it. Hopefully you'll make some money today.
I know. I hope so. I'm certainly going to try. Well, thank you for having me.
Absolutely. Take care. Have a good day.
Okay. You too. See you Saturday.
Okay, everybody. Have a good day. Take care.
Right.